Hi everyone, this is Heather Patel. I'm a practicing board certified emergency physician and hold a master's in integrative medicine. I take care of COVID-19 patients here at the VA in La Jolla. I've been getting the question a lot recently, that is, will this be the worst pandemic ever? And we really have to dive a little bit deeper into the symptoms, the diagnosability of this disease, the prevalence, and is there any treatment? First and foremost, what makes this so dangerous is that it actually has a 14 to 21 day incubation period. And I know that we're touting quite a bit about the 14 days, but there's some evidence out there that it might be longer. So this is the period where we have no symptoms. It infects our body, it transmits to other people, and it really creates a huge problem that we can see quite visible right now. Typically, there are no symptoms for the first 5 days, and we have no studied treatments that are available or vaccines yet. So the symptoms are very similar to flu, over 80%. At some point we'll acquire a fever, only 50% present with a fever in the emergency department. Over 70% have a dry cough. And then there's many other constitutional symptoms similar to the fever, like muscle aches, intestinal disturbances, headache or sore throat. I also wanted to touch a bit on if there are people who get extremely sick, what are some of the labs that I would expect other emergency physicians and healthcare providers to look at? So if you have a family member, you have some awareness of what to look for. So we would look for a low white count, a prolonged bleeding status, high LDH, and mortality or death rate is actually predicted by high CRP levels and high procalcitonin levels. So again, what's making this virus such a bad virus? It's the long incubation period. It's the fact that these mutations have evaded our immune system ability to control it. Therefore, it leads to a massive immune response. That massive immune response is what's leading to significant pulmonary issues and the symptoms that lead to near death. So I wanted to share what a clear CT scan looks like, what a normal CT scan looks like, and when somebody who's infected with COVID, on the top, this is a mild case. As you can see, there's patches, white patches throughout both sides of the lung. This is quite classic. And then as it progresses, these white patches infiltrate or get much more diffuse in the lung, making it hard to exchange oxygen and lead to significant cardiac and pulmonary problems. So who's transmitting this virus? Well, it turns out in the beginning it was healthcare providers from China. They weren't wearing PPE or protective equipment, and therefore we have statistics that show over 40% of the transmission was due to healthcare providers. Turns out the Chinese have a genetic difference than many of us in the world, and therefore that genetic difference made them susceptible to higher death rates, which have been quoted at 8 to 15%. Thankfully, outside of China, we don't have these genetic differences, and we are expecting a mortality rate of 1 to 3%, which we ourselves will be able to control based on how well we manage the spread. Healthcare providers here in America now are extremely cautious. We are using PPE or protective equipment that is above the standard quite often from the CDC from a droplet perspective. And so we expect healthcare providers to not be exposed, not be acquiring this disease as much, even though we do have some throughout our country, I know, and it's quite sad. But our healthcare providers are using all the measures and going above and beyond to limit this transmission. There is a metric called Rho naught, which was reassuring. This metric is used to identify what diseases are going to lead to pandemics and high levels of mortality. This R naught for COVID-19 is around 2.5, which is just slightly higher than influenza, and we get over influenza every year. So if we keep this controlled, then we will be able to control this disease. Another piece of information regarding transmission is what might actually you do differently at home. Turns out that we have a study that showed coronavirus will survive on steel and plastic for 72 hours, and for 24 hours on cardboard, and under 4 hours on copper. So if you have the opportunity to use more paper products or copper, please do so. We know that it does not survive as long on those items. A piece of information I found very helpful was to know the size of the virus. It's 120 nanometers, which means that we are safe using droplet precautions. That is, when you see a healthcare provider, we should be using surgical mask, gown, and gloves. Many of us are using precautions above and beyond that with an N95 mask or positive pressure mask whenever somebody has symptoms. So how do we as healthcare providers avoid coronavirus? Well, it's all dependent on the size of the virus. This virus is 120 nanometers, which means that we should be following droplet precautions. That means gloves, gown, and a surgical mask. Many of us are using more precautions than that, especially if somebody comes in with symptoms similar to COVID-19. We're using a N95 mask or a positive pressure mask. Looks a little bit like a Star Wars droid helmet. So the key takeaways from this are that the symptoms are very similar to flu. It's no surprise. It creates a significant immune reaction because of the mutated form. The best type of testing for this is a PCR test, which tests for RNA. IgM and IgG testing is not ideal quite yet. It is very different in each person from their response time, as well as this is a good marker and can be used down the road. But to control the virus and identify it early, it's the PCR test that we really need to be using. What about those people who aren't being tested versus those who are being tested? Well, it is true that in the emergency department, and based on what hospital we work at and what city we work at, we may or may not have significant amount of COVID testing available to us. Definitely anyone who is being admitted to a hospital should be getting tested for COVID that has symptoms similar to this or an exposure. On top of that, some hospitals are sending people home when they meet criteria, which makes sense from an epidemiologic standpoint to prevent spread, if they meet criteria and are safe to go home. Some of these folks aren't being tested, and if they're not, they definitely need to be sticking to the 14-day, maybe 21-day quarantine and the social distancing, along with the healthy hygiene measures. If they don't, it's useless. For those hospitals who are able to test, I think that that data can be useful down the road for us. And when we do have a treatment available, we're able to use that data to treat people more effectively and early. So what do we do now? Again, we're going to stick to the basics. I will talk a little bit more about some advanced research that is out, some new literature coming out on different therapeutic options, as well as integrative approaches to help boost and maintain or support the immune system. Right now, let's stick to the 6-foot distancing, social distancing, and our hygiene measures for the 60 to 70% alcohol, Clorox. Please do not sneeze without tissue paper and toss that away right away. And hand washing for 20 seconds. Please see our San Diego County.gov resources and our CDC resources. As for whether this will be the worst pandemic ever, I think I'm going to be following the R0 and see what and how well all of us are performing in our duty for humanity in containing this disease. Thank you, be safe, and be well.